Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
Welcome to Centerpoint. I'm your host, Dr. Ron Anbar. In this show, we will discuss ways that we can journey to our own centers. This can help us access our inner resources to improve our physical abilities and health, our mental strength, our emotional well-being, and our spirituality. And today I want to welcome a very special guest, Dr. Cory Hammond, who has been one of my mentors since I entered the field of hypnosis. Thank you so much for joining us today, Cory.
Nice to be with you, Ron.
So a little bit of a background on Dr. Hammond. He is a past president of the American Society of Clinical Hypnosis and is the author of the leading textbook in this field. We call it the Red Book. It's the Handbook of Hypnotic Suggestions and Metaphors. It was first published in 1990, and I can tell you, because I just published a book, as many people in the audience know, I track hypnosis sales, and I can tell you Dr. Hammond's book still is selling 30 years later as the top-selling book in our field. He's also had another 180 professional publications. He's the professor emeritus at the University of Utah School of Medicine, and he still sees patients 3 days a week in his private practice. So again, thank you so much, Cory, for joining us. And I would love to hear how you got involved in hypnosis, and like how many years ago was that, and what happened?
Well, it's been well over 30 years ago. Actually, my initial introduction to hypnosis was a podiatrist who was in our church, and he taught a class with some of us young boys that were 12, 13 years old, and to get us to not be so ruly, he introduced us to self-hypnosis and doing a little of that with us. And that was actually my first introduction many years ago. And then after I got my doctoral degree, then I pursued further studies in it.
Interesting. So when you learned hypnosis as a youngster, did you use it after you learned it, or you just said, this is interesting? How did you react?
Well, I occasionally used it as a self-calming kind of tool. When I felt myself becoming anxious before a test, things like that.
And when the podiatrist taught you this, you were interested in it as a youngster?
I found it interesting. Not enough that I would pursue it for quite a number of years, but I reflected back years later as I began serious study of it and found it interesting that I'd had that kind of a positive introduction many years before.
Interesting, because as a pediatrician, I see all clinicians who use hypnosis can see its great potential, and I've thought to myself, maybe we should teach this to all 11 and 12-year-olds. It can affect their whole life if they use it properly. But what I found was that if children do not have an immediate need for using it, they don't. And so maybe you illustrate that as well, although I guess you did remember enough, caused enough of an impression that you used it occasionally to calm yourself. So what happened professionally? How did you reintegrate it into your life?
Well, I simply saw a book that a next-door office neighbor had and asked him if I could borrow it, read it, and then decided to pursue further training.
Where did you get your training?
Well, I got some from William Kroger, one of the old-timers in the field, and from people within the American Society of Clinical Hypnosis. But I studied fairly broadly with quite a number of the luminaries in the field.
Did any particular luminary impress you most, or in terms of your professional development or personally?
Well, David Cheek, who was an obstetrician gynecologist, had a big impression on me, as well as the work of Milton Erickson. And, many, many other people through the years who are now no longer with us.
Well, they're with us through you, and then through your students. So in some ways, there's a lifelong influence or long-term influence. So as you learn more about hypnosis, and I know you know of its great potential, have you been frustrated with the slowness in which it's taken effect in a public sphere or among healthcare professionals?
Yes, it is frustrating. There have been so many opportunities for people to really use it that have passed by the way. Let me just say a couple of things about the things that impress me most with hypnosis and where it's underutilized. I have been so impressed with the efficacy and the research demonstrating that hypnosis is probably the most effective non-medication, non-surgical treatment for pain. There are innumerable studies documenting this, and I actually took a couple of people through surgeries where hypnosis was the sole anesthesia, one of those lasting 4 hours, and she was blocking the pain with her own mind. It can be useful with headaches. I published an article a dozen or so years ago in the International Journal of Clinical and Experimental Hypnosis summarizing the research on headaches. And I'd known from clinical practice that it was effective, but I had no idea how effective the literature proved it to be. Simply teaching someone self-hypnosis and getting them to practice that, I think, is more effective in the treatment of both headache and migraine than any medicine that is out there.
So can you explain? I'm sorry, go ahead.
Well, one of the things I found, sorry about my voice here, all. One of the things I've found fascinating is how the use of mental imagery can influence the body. I remember years ago there was a study at Stanford with people with gastritis, and one group was just taught relaxation, but another group were taught to imagine the gut changing. And instead of being red and inflamed and kind of bubbly, to imagine it gradually changing and becoming like a cool mountain lake. And as people would do that, they documented a reduction in gastric secretions. I've many times taken with a class at the university or a workshop and ask how many people were in pain. And it's surprising how many were. And I'd say, tell me about your pain. Somebody would say, well, I've got this knee pain or shoulder pain or back pain. And I would have them rated on a scale of 0 to 10. And then I didn't even use formal hypnosis. I simply said, all right, I want you to close your eyes and just take a couple of relaxing breaths. And I want you to imagine what that painful area looks like. Imagine the color, the texture, the size, and the shape. Maybe you'll imagine that it's red and inflamed and perhaps like a towel that's knotted up. And once you have that image in your mind, now I want you to gradually begin to transform that image, almost as if you have a dial in your hand, and you're very gradually, not abruptly, just gradually turning that dial and changing the color, the texture, the size, and the shape of that image until it becomes a very comfortable looking one. And then I would just be quiet for about a minute and a half. And then I would simply say, I'd like all of you to open your eyes now. And I would then pick out different people. I'd say, John, you said your pain level was a 6. What number would describe how you feel there now? And many times they'd say, 2. And Alice, you said your pain level was a 4. How does that area feel now? 0. And it was fascinating to the students to see how, without even a formal induction of hypnosis, just focusing their mind, which is what we do in hypnosis, relaxing a bit and focusing your mind, and then changing the imagery, how in just 3 minutes they could get a significant improvement in pain. And so this is one of the kinds of techniques that I would use with a wide variety of conditions, pain certainly being one of them.
How long will the pain relief last after an interaction like that?
Well, it depends. I've found in hypnosis, my preference with pain is to do more than that, to have a longer session. I prefer in the office, if possible, if we have the time, which generally I do as a psychotherapist, to take 15 or 20 minutes of what we call induction and deepening, and then to go through some of these kinds of procedures. Many times I'll make people a self-hypnosis recording. These days, often on their phone that they can use. And those are often a little bit shorter once they've had experience with this in the office, perhaps a 15-minute long recording. And many times make a couple of those, so they've got a couple of different resources to use. And I'll ask them to do that a couple of times a day. It kind of depends on the condition. If it's severe chronic pain, like a cancer patient, they may need to do it more often, maybe every 3 or 4 hours. With other conditions like irritable bowel syndrome, if I simply get them to do that a couple of times a day, the research that I've reviewed and others have reviewed showed that about 70+% of the time we get significant improvements in a condition like irritable bowel syndrome. I'll also often teach people a brief self-hypnotic technique so that if they don't have time to listen to a 15-minute recording, that they can just do this in their office. Or I'll tell people, if the only place you can get privacy is in the bathroom, it's socially acceptable to indicate you need to go to the restroom for a few moments and just sit there on the commode, and I'll teach them to do just a little 3-minute exercise to drain off the stress and tension and so on.
And can you explain what's your understanding of the mechanism? Hypnosis isn't magic, as the audience knows, but how does it work? How does using imagery affect perception of pain? What is your understanding of that?
Well, I wish I knew. I find it absolutely fascinating. There's some research that was done at Washington State University where they had one group of students simply go through a relaxation exercise and had them do that regularly. A different group of students were kind of prompted in terms of helping them to imagine what enhancing their immune system might look like, and helping them to develop some imagery so that as they relaxed, they imagined their immune system being enhanced. And they had them then practice this for some period of time. I can't remember, a week or two perhaps. And they found that the group who used imagery had significant enhancement of killer T cells compared to the other group that simply relaxed. And so I think it's sad where some people talk about, well, just doing relaxation training. There are certainly some benefits from that. But when we also use mental imagery, we can get a lot more benefit. I have a fascinating case. Many years ago, there was a young lady with some sexual dysfunction problems. And her husband was a graduate student in a university about an hour and a half away. And he'd ask if he could sit in on the sessions, and that was fine with his wife. One day, as she came in, she said, "I'm not sure I'll be able to get into the hypnosis worth a darn today because I just have this terrible cold." And so she said, I can hardly breathe. And so I said, well, let's go ahead and see what we can do. As I was doing some of the relaxation and induction and deepening, we call it, just for the heck of it, I said, I want you to imagine what that congested sinus looks like. Well, I was frustrated that she wasn't more creative, but she said, I simply see a dark hole. So I said, okay, I want you to imagine as if you have a dial in your hand and you're gradually turning it. I want you to imagine more and more light coming into that hole. Imagine that hole gradually opening up and relaxing and opening and becoming lighter and lighter. And just keep imagining that. And then I went on and did our other therapeutic work. When we finished the session, which I thought was wonderful work, what she was impressed with was not what we were working on. She said, I can't believe it. I can breathe. She said, as I was imagining that, I could hear my sinuses popping and opening up, and I could breathe. And her husband the next week commented on their drive home how she kept commenting about that, which I found absolutely fascinating in terms of the impact of imagery and that it can have.
You know, I wonder if imagery is the way their conscious mind used to communicate with the body before verbal language is developed. And I'm wondering that if when we do hypnosis and use imagery, if we're tapping into that deep way of communicating, because a lot of stuff happens in the body automatically without conscious control. But once our brains developed enough to have some thinking ability, how would we talk to ourselves if not through imagery before we knew language?
And I've just been fascinated through the years on how the mind seems to know how to use images to bring about the very thing we're imagining. I remember working with a U.S. ski team athlete, and his coach had come to me asking me to work with him. He was a downhill skier. And I said, well, I've only been on skis a few times, and I'm not sure I would be helpful. And he said that he and this skier would guide me. And so I began to work with him, and I was having him imagine a perfect downhill run. And as I would suggest different things, he would correct me and guide me in what basically to have him imagine. Now, this fellow had been coming in 5th and 6th in giant downhill races, but then he'd had a bad fall, and it really shook his confidence. And he was now coming in like 25th in races. And after about 3 sessions of refining things, I made a recording for him and asked him to use this a couple of times a day, imagining just a perfect, fast downhill run in great detail. A week later, he went back for the last World Cup race of the season in Europe, and he came in first place by a full 2 seconds. Our mind knows how to use imagery, success imagery in this kind of case, to get us where we want to go. And so I think in terms of executives, in terms of athletes with peak performance, as well as with medical conditions and psychological conditions, using mental imagery as part of hypnosis and self-hypnosis has very, very powerful effects.
I think you're right. I think all top athletes and perhaps all top people in the world use some form of imagery. The reason they're at the top is because they know how to use their minds to the best of their abilities. Thank you so much for sharing all this. When we come back, I'd love to ask you how you feel about the role of the subconscious in how hypnosis works. This is Centerpoint with Dr. Ron Anbar.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
HealthyLife.net, where positive overcomes negative.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
Audiobooks gives you instant access to over 50,000 of the best sellers and hottest book titles in romance, mystery, fiction, and many other genres. Just visit HealthyLife.net's advertiser page and click on Audiobooks to get started.
Every year since opening Centerpoint Medicine, Dr. Ron Ambar has been overwhelmed with demand for his services, so much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
HealthyLife.net, where positive overcomes negative.
If you are a medical or licensed healthcare professional or just anyone looking for a qualified hypnosis practitioner, then go on over to ASCH.net. That's the American Society of Clinical Hypnosis. At ASCH.net, you can get certified, attend workshops, and even find a hypnosis practitioner or consultant. ASCH provides an opportunity to learn and interact with colleagues. So whether you're a professional wanting to learn hypnosis or a patient wanting help with a problem, visit ASCH.net now.
More exhilarating talk. HealthyLife.net.
Welcome back to Centerpoint with Dr. Ron Anbar and our special guest, Dr. Cory Hammond, who has shared some wonderful experiences over the years. I've become very interested in the subconscious and direct interactions with the subconscious through my work, and I'm wondering if you could share how you view the role of the subconscious in the hypnotic phenomenon we observe.
I think there are two different ways of using hypnosis. One is what I call suggestive hypnosis. And with many conditions like weight control, smoking, many times with pain, simply doing suggestive hypnosis is very, very adequate. But I think occasionally there are unconscious kind of factors that can also be there. And let me give you an example. I had a woman come to me, and she had been in pain for quite a while with the temporomandibular joint kinds of issues. And she told me as part of her background that she had been trapped in an elevator. And I think it was on something like a 7th or 8th floor. And she was alone in the elevator, and suddenly it kind of stopped. The lights went out, as I recall. It made strange creaking sounds and then dropped. She estimated maybe a floor and jarred to a stop. She crashed to the floor. She broke her glasses, hit her face, and she already had this pain problem, and now it was even worse. Well, she was trapped there for close to half an hour before they could get her. Finally, what happened is she managed to pry the doors open and managed to get out and run up the stairs to her office. She wasn't ready to go back in what we call an age regression and work through some of those feelings. She just didn't feel ready to face that. And this had happened quite a period of time before, a year or more before. So I did suggestive hypnosis with her, and she was able to relieve about 50% or 60% of that pain. But then she finally said she was ready. And so we did an age regression, went back, helped her to work through the feelings therapeutically about that. And after that, the other half or so of the pain completely went away. And I actually had an opportunity to have a 10-year follow-up with her. She was a legal secretary and had called to see if I would be involved in a forensic hypnosis case. And so I had a chance to visit with her, and she said that half of the pain had never come back. And she was still using self-hypnosis to cope with the other pain. And so I find sometimes there are unconscious kinds of things that we may not be aware of. Pain may serve an unconscious function of punishing oneself for things that you feel guilty about, or other kinds of things like that. And sometimes we need to use a method of getting in touch with some of that unconscious material and helping to remove that block. The thing about doing that kind of work, however, that I think is vitally important is that the person you're working with hypnosis is a licensed healthcare professional, a psychologist, a social worker, a physician, a nurse practitioner, because there are a lot of what we call lay hypnotists out there who may have been a used car salesman, and then they saw some advertising and they took, a 6-week Saturday course and now had a little diploma saying that now I'm a hypnotist or a hypnotherapist. And these people can be dangerous and can cause ill effects. And so I think it's very important for the public to check into the credentials. In addition to to knowing hypnosis is someone licensed. Here in the state of Utah, I actually helped write the law so that lay hypnotists can work with things like smoking cessation or weight control, but they cannot work legally with any psychological, medical, or dental kind of problem.
How can someone in the public ensure that their hypnotherapist, besides a license, has gotten appropriate training in hypnosis?
Well, there are two major hypnosis societies, and most of the people who are very dedicated to hypnosis and learning to do it right are members of either the American Society of Clinical Hypnosis, which is ASCH.com or .net, or the Society for Clinical and Experimental Hypnosis. And so through those organizations is a good way of determining people who have had legitimate training and certification in the field.
Right. The American Society of Clinical Hypnosis, ASCH.net, actually has a listing of their members by location, so the public can actually look up, they can say where they're at, and they'll be told their nearest therapist who might be able to work with them, who is licensed, who has received appropriate education. But that actually brings up a question. I know that your therapist needs to be in the state where you're located, but sometimes people are living in remote locations. Have you had experience with providing hypnosis therapy through video conferencing, for example?
I have not been willing to do that unless the person has been a patient of mine. And there can be problems with doing that because I know of a person, for example, in Texas who was working with somebody in California, and they were not licensed in California, and they were prosecuted for practicing psychology or medicine without a license in California. So it's important that the person is licensed in your state. I would simply look into that. And I would be careful about all of the prefab tapes. Used to be audio tapes, now CDs and things that are advertised. I would really look into what are the credentials of the person who are offering those. Are they a legitimate psychologist or physician, and so on. And I think that's just a safeguard for the public.
Right. Another thing about prefab tapes is that they're not individualized to your needs, and they're likely be less effective for whatever you're dealing with. Yeah. Well, Cory, Dr. Hammond, it's been wonderful to spend some time with you. As I mentioned earlier, you were one of the people I followed and learned from for as long as I've been involved in the hypnosis world, which is, I guess, more than 20 years now for myself as well. How time flies. And thank you so very much for spending some time with us today, sharing from your vast knowledge and experience and teaching us how hypnosis can make such important changes in people's lives. So thank you so much.
It's nice to be with you, Ron.
Great. So this is Centerpoint with Dr. Ron Anbar.
Make-A-Wish has been granting life-changing wishes for children and families for over 40 years. A wish is something that gives children the opportunity to look outside their illness and restore a sense of childhood back to the child. With the help of donors and more than 43,000 worldwide volunteers, Make-A-Wish has collectively granted more than 520,000 wishes worldwide. Dr. Anbar has referred many patients to Make-A-Wish. To make a donation, go to worldwish.org. That's worldwish.org.
HealthyLife.net, the Positive Radio Network.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit drambar.com.
Reach your health and fitness goals. Whether you want to lose weight, learn to dance, build muscle, or just live healthy, Beachbody gives you unlimited access to the nation's most popular fitness and weight loss solutions. Visit our advertiser page and click on Beachbody now.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
HealthyLife.net, where positive overcomes negative.
Every year since opening Centerpoint Medicine, Dr. Ron Ambar has been overwhelmed with demand for his services. So much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
All positive talk with a mature edge. HealthyLife.net.
This is Centerpoint with Dr. Ron Ambar. We've had a marvelous show today, interviewing Dr. Hammond, learning about his various experiences. And in this segment, I like to share experiences I've had with patients over the years. And I'd like to tell you about a young lady that I met in 1998. It was Veterans Day, and I was a pediatric pulmonologist at the time, and our respiratory therapists would go out into the community and perform pulmonary function testing on children, on athletes, young adults, and I would then interpret the lung tests and tell them what to find out, what should be done. We would look for patients who had asthma, for example, and there was a little questionnaire we had developed for the respiratory therapist to administer to the young people, because I would not be seeing them in person. So on that particular day, my therapist met with this young lady, and she was out of breath. She was an athlete, and she, when she was engaged in competition, she became very out of breath. And as she answered in the questionnaire, she had difficulties breathing in, and she actually had to stop her running because she couldn't breathe. And then she'd rest a few moments, and her breath would return, but when she resumed running, she'd again have trouble breathing. And this happened usually during races or occasionally during practice. And when the pulmonary function test was performed, it was completely normal. And so that kind of scenario, I recognized, as did my respiratory therapist, that the problem was unlikely to be asthma because the breathing test was normal, and the young lady's difficulty breathing, because they occurred when she was breathing in, were most likely the result of a diagnosis of vocal cord dysfunction, in which the vocal cords close when you try to breathe in, so you can't really breathe. And typically, this occurs when young people stress themselves, most often in high-achieving teenage girl athletes, but also for boys. And sometimes the stress is not related to the sport. It could be for other reasons. But in this case, it was pretty clear this was a high-achieving young lady who wanted to race in national competitions, and this was probably the case, that she was developing vocal cord dysfunction. So what we would do is typically we'd give her an appointment at my clinic in a few weeks, and I would teach her hypnosis, which is a good therapy for this condition. However, this young lady had a race coming up 3 days later, and she wanted to be seen immediately. And I didn't really have time. And then a few minutes later, the pediatrician called and said, "Please see this young lady immediately, because her mother and the young lady want to fix this problem." And I thought to myself, oh, my goodness, I don't know if we can fix it in one session. And plus, I wasn't sure if the parent is so intense. Sometimes the parent wants to fix the problem even more than the kid, in which case it doesn't work. Because remember, all hypnosis is self-hypnosis. But because the pediatrician insisted and because I wanted to do what I could, I said, okay, bring her in. I wasn't quite sure how it's going to work. So the young lady came to see me, and I told her, well, I'll teach you how to calm yourself, and by so doing, you should be able to overcome your vocal cord dysfunction. So I asked her to think of a calm place where she felt safe, and she picked heaven. Okay, so I just go along with that, and I asked her to imagine what she could see and hear and smell and feel and taste there, and she said that she imagined being in a cloud in heaven, and initially she couldn't see much there, but then she said she saw some dogs coming up, and then she visualized a dog placing a star in the sky, and then she felt a lot of papers falling on top of her that she had to dodge. And she stayed in that hypnotic state for like 8 minutes. And when she came out of hypnosis, and by the way, the time she stayed was her choice. I let her be there as long as she wants. When she came out, I said, let's not discuss the unusual imagery you had, because she developed the dog and the star and the paper imagery on her own. And I said, maybe you can think about later what those represent. For example, did she put too much stress on herself academically, which is what the papers represented. So then, after that, I said, let's go ahead and imagine you're in a cross-country race, and when you have trouble breathing, you can calm yourself by making your relaxation sign. This is a sign that she had pre-programmed in herself once she became calm in her heaven experience. So she imagined running, and she started breathing like 60 times a minute as she was imagining it. Now, normally you should be breathing like 12 to 16 times a minute. Maybe when you're running, it goes up to 20 or 24 times a minute. So that 60 times a minute was too fast. So I suggested, why don't you imagine a metronome? And imagine a metronome going 60 times a minute, and then slow the metronome in your mind to 50 to 40 to 30, all the way down to 20, which she did. And as she did so, her breathing slowed down to the rate that she was imagining. I told her when she came out of hypnosis that this is what she can do when she runs if she starts breathing too fast or having trouble breathing, to imagine the metronome and to use her relaxation sign. So I reminded her that all hypnosis is self-hypnosis, that she should practice it regularly because it's a mind-body skill, and just like running track, the more you practice, the better you become at it, and wished her luck in her upcoming big race. So 3 days later, she competed in this race. Within the first mile, she got some shortness of breath, but she immediately imagined the metronome and controlled her breathing. And her mother later told me that this young lady was the quietest breather around of all the runners. And actually, if you ever go to a race, a cross-country race, and observe the runners, you'll see many of them breathe loudly, especially near the finish line. They breathe in loudly when they inhale, and that's vocal cord dysfunction, which is actually very common if you start looking for it. So that was it. That was the only time I saw her. She was fine thereafter. A year later, I saw in our local newspaper that she had been chosen as the high school all-state champion in track. So, despite my misgivings about being pressured to see her right away, she actually improved immediately, as do many young athletes with vocal cord dysfunction. And I can tell you that if she had not learned to do hypnosis, it is unlikely that her vocal cord dysfunction would have resolved so quickly. It wouldn't have. There is a medication that sometimes patients take. It's called ipratropium bromide, or brand name of Atrovent. So for vocal cord dysfunction because of athletic issues, that can work as well. You take 2 pills before exercise and you get better. Of course, I'm biased towards the hypnosis because that does not require medication, that does not have any costs other than the initial session, and there's no side effects. But if you can't get to a hypnotherapist, Atrovent can be a fine solution. If the stress that's causing the vocal cord dysfunction is stress generated by the athlete herself, something external, like somebody's bullying the child. And Atrovent, by the way, works by blocking the effect of the vagus nerve. The vagus nerve is the nerve that connects the brain to the body, and so by blocking its effect, it's blocking the stress perhaps that's caused by the brain that affects the breathing. So this is one more way that hypnosis can help patients in calming themselves and helping them breathe better. This is Centerpoint with Dr. Ron Anbar.
More than 30,000 children and adults of every race and ethnic group in the U.S. have cystic fibrosis. Cystic fibrosis is a disease causing long-lasting lung infections, limiting the ability to breathe over time. Dr. Anbar participated in research that helped advance survival of cystic fibrosis patients by more than 20 years. He encourages you to donate to the Cystic Fibrosis Foundation to help find a cure. It's easy to donate. Go to cff.org. That's cff.org.
HealthyLife.net, the Positive Radio Network.
If you are a medical or licensed healthcare professional or just anyone looking for a qualified hypnosis practitioner, then go on over to ASCH.net. That's the American Society of Clinical Hypnosis. At ASCH.net, you can get certified, attend workshops, and even find a hypnosis practitioner or consultant. ASCH provides an opportunity to learn and interact with colleagues. So whether you're a professional wanting to learn hypnosis or a patient wanting help with a problem, visit ASCH.net now.
Constant Contact and your small business make a perfect fit for marketing. They give you what you need to succeed. Fast and easy email marketing at your fingertips. Visit the HealthyLife.net advertiser page and click on Constant Contact to start your marketing.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
HealthyLife.net, where positive overcomes negative.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
Radio your way. HealthyLife.net.
Welcome back to Centerpoint. I'm your host, Dr. Ron Anbar. We just had a wonderful time interacting with my good friend, Dr. Cory Hammond, who shared some of his experiences with us. I wanted to focus today on pain, which, interestingly, Dr. Hammond discussed. So in this segment, we're going to talk about how you can use hypnosis-like techniques to deal with pain. Dr. Hammond already gave an example of telling the person to think about something calming and to relax, and then to imagine a dial or lever that represents the discomfort, and to slowly change the discomfort on the dial or lever, and notice how people feel differently thereafter. And if you're a parent, you can do this with your child. Asking somebody to rate the discomfort on a scale is already kind of dissociating. It kind of you start thinking about the discomfort in a different way, and that's just asking to say, please rate it on a scale of 0 to 10 or 0 to 100. How it feels makes people look at their discomfort differently. And then you can talk about what happens to your discomfort when you take Tylenol. What happens if you take a warm bath? Drink a cup of hot chocolate? Or play a game of cards? Notice what happens. And so by asking people to pay attention to their body sensations based on whatever activity they're doing, they can learn that, yeah, this feels differently when I'm doing something fun or calming or soothing. And then people can start learning, I can help my own discomfort. I don't need to necessarily complain about it. I don't need to ask for a narcotic. I might not even need to ask for Tylenol, because I'm aware that a certain activity or a certain way of thinking can help me feel better. And so when you experience a discomfort or a loved one experiences a discomfort, by talking about it in a perspective of how does it feel, how do you think it can change, what can you do to change the way you feel, that opens up the possibility that you will improve or the patient will improve. So in the world of hypnosis, you would show someone how to enter the relaxed state and then manipulate the lever or change the color of the discomfort or change its sound or change its smell. Notice I'm showing you all of the different senses again, because as you think about different senses as applied to your discomfort, you will perceive the discomfort differently. And again, how that works, as Dr. Hammond said, we don't quite understand, but we do know it changes people's perspectives. So, when you realize that you can be in charge of your own discomfort, you start having control over it. Oftentimes, when people are in pain and they think there's nothing they can do about it, they panic. Will this last forever? Am I ever how long will it take before it gets better? Will this be a long-term problem? When they realize they have some control, and sometimes a lot of control over the discomfort, they start taking charge, and their anxiety level goes down, and with that decreased anxiety level, their discomfort level goes down. Notice I'm using the word discomfort rather than pain. That's also a deliberate choice. Why? Well, when you think about pain, things don't feel good. But if you think about discomfort, or better stated, discomfort, you're thinking about comfort. And as we talked about in a previous show, the words you use, the thoughts you have, manifest your reality. By by using words like discomfort as opposed to pain, you're helping yourself achieve more comfort. You're directing your mind in a way of asking yourself, how can I turn from discomfort to this comfort? Play of words, yes, but it has physical effects. Just like playing of imagery, it's just imagery, has physical effects. And when you think about fairy tales you might have heard as a child, or stories about another person that you might have heard as an adult, you start to gain an appreciation of why stories, even fables, can affect us humans in good ways or potentially bad ways, depending on what we hear. And therefore, another lesson to take from understanding how to change the way you feel is you want to be careful and mindful of what you expose your mind to. Because what you listen to, if it's music or politics or a gossip, whatever you listen to can affect you in a good way or a bad way. It's usually not neutral. Usually there's some effect. So be mindful of what you listen to. Understand it can affect you and affect the people you care about. And then pick things to expose yourself to that help you feel better. For example, when I was in medical training and working in the emergency room, it was an intense experience. And when I come home, I would be watching the television show ER, which was a rather dramatic show. And I didn't want to watch it. I didn't want to expose myself to that because it was a very intense show, very dramatic, and it reactivated my feelings that I had experienced during the day. And when I was home, I wanted to rest and feel calm. So I preferred to listen to soothing music or read a book with calm ideas as a way of calming myself, as opposed to exposing myself to a television show that would rile me up. So be mindful of what you expose yourself to and notice the improvements in yourself as you do so. This is Center Point with Dr. Ron Anbar.